All right, guys. Happy Sunday. All right. Couple of chapter 28, chapter 32. So chapter 28 is our respiratory. That's the main one. And then chapter 32 is care of the elderly. As you've gone through that chapter, you will see we have covered it in many of our other chapters, but as a few key things I'm going to point out. All right, so for chapter 28, that's where we'll get started, respiratory. Key terms you need to know and be able to recognize the definitions of is your hypoxemia, hypoxia, incentive spirometer, atelectasis, sputum culture, and a pneumothorax. Okay, so be very familiar with those definitions. Okay. So let's talk about a few things about our respiratory care. Oxygen, what's the purpose of it? Okay, inhalation and expiration. How does it work? Okay. Remember, if the lung collapses, that's atelectasis. All right. And nursing diagnosis. So if we had a nursing diagnosis for a patient, all right, who was having hypoxia, what type of nursing diagnosis would we give that patient? What would be a priority one? All right, if we are doing oxygenation levels, all right, what do we check for? Do we check their rate? Do we check their chest expansion, symmetry? And how about their pattern, the breathing pattern, and the effort? So all right. Also, be familiar with the different masks. Table 28.4, the oxygen delivery devices and their flow meters. So your nasal cannula is 1 to 6 liters per minute. Your simple face mask is 5 to 10 liters per minute. Right? Your partial rebreathing mask is 6 to 15 liters per minute. Your non-rebreathing mask is 6 to 15 liters. Your Venturi is 24 to 80%, sorry. Face tent, 8 to 12 liters. All right, and then your trach. So remember, if somebody has a trach and we need to provide them oxygen, do we want to humidify it? And what does the humidifier do? Okay. All right, so table 28.4, sorry. All right. If you're conducting a health history for your patients, right, and during that health history or assessment, they complain of respiratory problems, what's your first priority going to be? If somebody has a high level of carbon dioxide, like our COPD patient, what do we expect? Remember, we're going to see that increase. Their respirations are going to be over 20 because we're trying to get rid of it. If we have, so remember I said our sputum, you need to recognize the different colors. So if we have a frothy pink tinge sputum, what does that mean? And what would be our greatest concern? So frothy pink sputum is pulmonary edema. All right, so make sure you be able to recognize that. And what are our actions with that? All right, pneumonia. What's our before we go into pneumonia? What's our normal oxygen saturations? So when we do a pulse ox, what's our normal? I think I froze up for a minute there. I think I'm back. Okay, sorry. If we have an abnormal oxygen saturation, what does that mean? All right. Are we diffusing correctly? Do we have a balance or an imbalance of gases? Okay, be able to recognize, so if we have 4 patients, who's going to take priority? Remember, your ABCs are always going to take priority over teaching. Okay. And then what comes after that? So looking at that patient status, who's going to be the first person you're going to go sick? And that's your critical thinking. If we have somebody who has pneumonia and they have those thick secretions, right, what are we going to do? How do we help thin out secretions? Fluids? Remember we talked about that with our COPD and that thick mucus thing. Remember they have that pursed lip breathing. What does that mean? So why does somebody have a pursed lip breathing? COPD. We've covered a lot of different patients in our simulations with COPD, chronic obstructive pulmonary disease. What's their normal? If we were going to have them on a nasal cannula, remember I said we would keep them at 3 liters, because anything over 3 liters can imbalance the gas exchange inside their lungs. All right, again, you have patients that come in, and if they are oxygens or sats are in the 70s to 75%, so if they're under 80%, what type of oxygen delivery system would they have? Would a nasal cannula work? Is that going to get them up to levels to about 94, 95? Or should we, a BiPAP, is that going to help? Or do you actually think we got to do mechanical ventilation because those oxygen sats are so low because of the injury they sustained? Somebody with a trach. We have our trach. Remember we talked about you're never going to cut your gauze. It has to come a split already to put around the trach. So if you saw somebody cutting the gauze, what would you do? Okay, that would be a safety concern, correct? Because what can happen? Thinking of pulmonary disease and respiratory issues, what can cause them? Smoking, environmental, what are the other options or work that can cause pulmonary problems? Working in a factory, okay, being in those closed environments, stuff like that. Okay. What's chronic bronchitis? We've discussed that quite a few times. And what do we expect to see with chronic bronchitis? What's the importance of turning, coughing, and deep breathing? All right, those are the big key things for chapter 28. Those oxygen levels the normal. All right. Chapter 32, I said care of the elderly. Two key terms you need to know: ageism, that definition, and glaucoma. Those are the two. We spoke about glaucoma, what is it? And then what is ageism, sorry. All right, so ageism is that discrimination and prejudice against elders. Okay, so you see a lot of that. People take advantage of them because they trust people and so on and so forth. So what do we do as nurses? Should we try to educate them? Not to open the door, make sure they know who they're letting in, and not to give out their personal information, correct? If you have an elderly patient and you're doing an assessment on them, somebody over 85, should you check to see if we have any dementia or Alzheimer's sitting in? And how do we do that? That would be our mental status exam. Maybe check their mental status to see if you got any signs of dementia kind of coming on. All right, if you have a patient with diabetes, right, because we know in the elderly with diabetes, what are some of the things we need to watch? Check their sugars, right? Should we check their feet though, because they can't always see their feet, or they maybe shuffling, step on things. So feet is a big concern for the elderly with diabetes, correct? If you have the elderly, what are some concerns that we talked about? We know their GI tract slows down, right? They're more apt for dehydration, so that means they're all more apt to have less bowel movements. And so if you were in a facility, what would be some things that you would check for? Do they need their food cut? Do they not drink water with it? Do they need a thickened liquid because they have swallowing problems? Do they have nutritional supplements? We talked about that. Remember, so they don't eat as much, so maybe we want that Ensure Rhythm. So if we have an elderly person who does have COPD and they have difficulty, well, not difficulty, but they get shortness of breath with activity, how do we help them? How do we encourage them to do more activity? Slowly increase their activity. All right, if we have an older adult and we do need that sputum, so sputum culture from them, when is the best time to get a sputum culture? We should all know when you wake up in the morning, you have all that drainage. So is the morning the best time? So you educate them and tell them we're going to have a sputum culture. We need a sputum culture, not have. We're going to need a sputum culture and do it first thing in the morning when they would have more secretions be able to come up. So remember I said 3 liters is the max for somebody with COPD, but if somebody with COPD, you should start them on 2 liters to see if they tolerate it, because 3 would be the max. So if 2 gets them up to their target O2 levels, then that's where we want to start. 3 is the max. I just wanted to reiterate that for your numbers. pH, okay, remember we need to know our acid and base balances, so we need to know our normal pH of our body. When are we acidic and when are we alkalosis? All right, so remember when we have an elderly patient who has some respiratory problems, what would be some concerns? So if we have some mucous membranes that are dry and ashen, would that be a flag? Would that be something to look at, be a concern for? If we have an elderly patient who's being discharged and there's concerns about taking care of them at home, who would we want to contact to assistance? Would you want to set them up with a social worker so they can get the assistance that they need? And then what safety features would we want to make sure is available for them at home, like the walk-in showers, the bars for the toilet, stuff like that. All right, and we'll review, but I hope this helps for some of the stuff we did not get to cover.